understanding why discs get damaged is the process called imbibition. Imbibition is basically the ability for disc to absorb water from its surrounding, because the disc itself does not have water or oxygen or blood supply directly going to it. It gets all of that from the vertebra above and the vertebra below. So as long as the disc has the ability to create that pump mechanism, it has the ability to create through osmosis the ability to get oxygen, water, and nutrients into it, maintaining its healthy state. When the disc gets damaged, it loses that ability, and therefore it doesn't get the water, the oxygen, nutrient, becomes more brittle, dehydrated, or also what's called desiccated. Now, imbibition takes place basically from birth to the age of about 35. At the age of about 35, just like many other things, hormones and so on, it starts to go down. This is why so many back problems are prevalent around the world in the age group of 30 to 60, 70, 80 plus. The presentation of a healthy disc. Basically, when a disc is healthy, there's a lot of space between the vertebrae, okay? And when we move, when we bend, when we twist, what happens is it creates a movement and a pump mechanism within the disc. This allows water, oxygen, and nutrients to be pumped into the disc. So in a healthy disc, we have this mechanism. The motion creates a pump mechanism, bringing the oxygen, the water, and the nutrients into the disc. When this is healthy, this equals a pump mechanism of hydration. Unhealthy disc. And the difference is, as you can see from the space, is that this disc has been damaged, and as a result of that, we don't have the same amount of space. Another thing I forgot to mention is when the disc is healthy, we have a huge hole here for the nerve root to be able to come out without any compression on it. When the disc here is damaged, there's less space. The water ability to get into the disc is decreased, oxygenation is decreased, nutrients are decreased. So basically what you have is a stagnant disc that doesn't move very much, and you feel stiff. Well, the longer that stays dehydrated, the more chances, just like a dry sponge, as you start to play with it or twist it, will break apart. Well, that's what happens here. So in an unhealthy disc, we have a decrease of water, decrease of oxygen, decrease of nutrients. The hole here where the nerve normally comes out is also decreased, putting pressure on that nerve, okay? We have a smaller hole compressing the nerve root, which equals pain. Now, the other thing that happens is it causes the tissue to dehydrate and break down, just like I mentioned, a dry sponge. This is a model of a vertebra, a disc, and then another vertebra. Ideally, the function of the disc is multifold. It's to create the ability to absorb shock, but it's also a spacer keeping the vertebrae apart so that this hole here is very big for the nerve root to be able to come out without any compression. And the other thing that happens is that we want these joints to be nice and healthy and be able to glide, and having that space allows that. If the disc is compressed and non-existent, then those joints are pretty much, as you can see here, they approximate, they get closer together, and then they can't really move. This is where people start to become stiff and wake up in the morning feeling really tight and contracted. When the disc is healthy, it allows separation for the vertebrae as well as normal motion to the disc and the ability for us to move and do whatever we need to do. So now what happens is when that disc mechanism, that pump mechanism fails, we don't have the same thickness to the disc. And as you can see here, what happens is that that disc starts to fail. Imagine a jelly donut and you start pushing on it, that jelly has to go somewhere. And that's exactly what happens to the disc. So it goes out, it can contract and compress on the spinal nerve itself, or it can go in the middle of the canal, putting pressure on the spinal cord, and that can also be called spinal stenosis. Now what we have here is a model, obviously a piece of sponge that represents a disc. When the disc is nice and healthy, it has the ability to move and bounce and absorb shock. Also, if I were to put this in a bucket of water, it would absorb all the water, and then I could pretty much do anything I wanted with that disc because it would be very malleable and very flexible. Here's the problem though. Earlier we spoke about the imbibition process and how by the age of 35 we start to lose that. So what happens is the disc, even through trauma or playing sports or poor posture, that disc, when it's under stress, begins to lose the ability to absorb water and nutrients and oxygen. So as it gets thinner and thinner, it becomes drier and drier. What happens is that now that the disc is compressed, it has lost that disc pump mechanism, that ability to absorb water and be able to move and give us full range of motion. Now imagine not having oxygen, water, and nutrients going into that disc. What's going to happen to it? Just like if this sponge was left out in the sun and dried up, and if I started moving it, it would probably just fall apart. So most problems, as we've explained before, to the disc is a compression problem. So if compression and the weight of the body doesn't allow the disc to be able to do its normal function, we don't have that pump mechanism. And we need that. We need that for the disc to be healthy. So the logical solution is not to cut the disc away and then fuse everything, but rather to restore the pump mechanism back into the disc. And that's what our treatment is designed to do, to restore that pump mechanism and slowly rebuilding it by giving it water, oxygen, and the nutrients that it needs to rebuild itself and heal. We use specialized equipment that was designed specifically through research to create that specific mechanism, which allows that disc to be pumped and to regain and reabsorb water, oxygen, and nutrients back into it, giving it everything that it needs, just like if you planted a seed and you give it water and nutrients and sunlight, that seed is going to germinate and grow and become healthy. And that's what we want to do to the disc. We know it's active tissue. All we have to do is re-stimulate that process of healing by giving it what it needs, which is oxygen, water, and nutrients, to have all the tools it needs to heal. Eventually, if you don't find a non-surgical way, which is what we offer here, to correct that, you'll end up having surgery. And that's the last thing you want. Most people agree to that. Statistically, the surgical outcomes are not good. Between 50 to 30% success rate, which means there's a 70 to 85% non-success rate. And so we do everything in our office to avoid drugs, shots, or surgery. Our whole approach is based on that. Everything we do is non-surgical, and that's what we offer here. In the next video, what I'm going to present to you is the solution to recreating the disc pump mechanism so that the disc herniation or bulge gets reabsorbed back into its neutral and normal position, allowing the disc to heal and allowing you to get back to having a normal life and being able to be active and playing with your kids or going out and working out, enjoying your hobbies or sports.